If I could have your attention, I think we'll go ahead and start the briefing. Welcome, and thank you all very, very much for being here this morning. My name is Russ Pate. I'm with the School of Public Health at the University of South Carolina, and I'm here today in my role as chair of the board of directors of the National Physical Activity Plan Alliance. And as I think you know, we're here for a very important purpose this morning, and that is to release the 2018 report card on physical activity and children and youth. And in just a moment, I'm going to pull my colleague and friend Peter Katzmarzyk up here to present the new report card. But as I do, let me mention that Peter and I just concluded a term of service on the Physical Activity Guidelines Advisory Committee, and that committee produced a very detailed report, some of which deals with the relationship between physical activity and health in children and youth. And the committee concluded that for school-aged youth, higher levels of physical activity are associated with better cardiorespiratory and muscular fitness, better cardiometabolic risk status, better bone health, and reduced risk for excessive weight gain and less risk of developing overweight and obesity. Also, for the first time, the committee addressed physical activity and its relationship to health in children under age 6, and again concluded that there was strong evidence that higher levels of activity are associated with better bone health and with reduced risk of excessive weight gain, even in our very youngest children. So clearly there's a need, a good reason to be concerned about the physical activity levels and the extent to which our communities are supporting children's physical activity across this country. And so with that background, I am going to ask Peter to come forward. Peter is a professor and center director at the Pennington Biomedical Research Center associated with Louisiana State University in Baton Rouge, and he has chaired the advisory committee that has developed the report card that will be released. Peter, all yours.
Thanks, Russ. Hey, good morning, everyone. Morning. Pleasure to be here. As Russ said, I had the honor of chairing the Research Advisory Committee for this year's report card. It was a very exciting effort. We had a terrific committee over the last year that pulled together all the data which we're going to speak about. So today we're releasing this third U.S. report card on physical activity for children and youth. The theme of this year's report card is on bridging the gap, bridging gaps actually, making physical activity accessible for everyone. So the primary goal of this report card is to assess the level of sedentary behavior and physical activity among children and youth, as well as the barriers and facilitators to physical activity. The target audience is not so much the children. The target audiences are adult decision makers, those people that can make a difference in children's lives. And the report card provides data upon which we can track progress and moving the needle in terms of getting kids more physically active. I also believe it provides a level of accountability for adult decision makers. We have to hold them responsible for our children and for our children's health. This year, we graded 9 different indicators, as you see on this screen. These were all different indicators where the Report Card Advisory Committee had to establish benchmarks and identify data, usually nationally representative data, in order to inform the grade. So this is the grading rubric of the report card. It's very similar to what we use in most U.S. schools, you know, A, B, C, D, and F. So most people would be familiar with this grading scheme. The grade of incomplete is I and C. For 2 of the indicators, we had to give an incomplete grade because we didn't have sufficient data to provide a grade. In other words, the committee thought that it was important to include that benchmark. However, we don't currently have surveillance data which could address that gap. So now I'd like to turn to this year's results. I'd like to point out that there are 2 versions of the report card. One of them, which was in the packet, is the summary version or executive summary. We also have the longer version, which is 60 or 70 pages long, and it's available on the National Physical Activity Plan's website. This provides all the background data and all the background to the report card. So for the third cycle in a row, we've assigned a grade of D- to overall physical activity levels. This grade indicates that there are insufficient physical activity opportunities for the majority of children and youth in the United States. Approximately 1 in 4 children are meeting the U.S. physical activity guidelines of 60 minutes a day of moderate to vigorous physical activity. There's a fairly noticeable gender gap as well, where boys are more active than girls across all of the surveys that we looked at. And you can see that in this line. Boys are in red and the girls are in orange. So we need to address this gender gap for sure. The grade for sedentary behavior has remained fairly much unchanged over time. Approximately 1/3 of children engage in the recommended levels of sedentary behavior, which is less than 2 hours a day of television viewing or screen time. Actually, in this one, more girls meet the indicator than boys. So active transportation is interesting. This is somewhere we've seen a little bit of movement, actually, no pun intended, but we only considered data in the previous report cards on active transportation to school. And very few children use active transportation to get to and from school. It's only about 12 or 13%. So that's why the grade was an F. This year we had access to data from the U.S. National Health and Nutrition Examination Survey, where they asked children more broadly about active transportation to and from different places. And we see here that it's about 23% of children and youth use active transportation 5 or more days of the week. So in this case, we improved the grade slightly, mainly because we had access to better data to inform the grade, and we actually see that 12% may have been a low estimate for overall active transport. So one of the highest grades has traditionally been organized sport participation, and it is also the highest grade on this year's report card, tied with one other indicator, where we see that about 50% of kids, 50% of high school students participate on at least one organized sport team. However, we also identify some gaps here. In this figure on the right in blue, we see that there's a fairly strong trend with socioeconomic status. So on the bottom axis, you see this is annual household income per year, and we see that families or children from families with higher income tend to participate more in organized sports. It's about 89% versus 70% of kids with lower socioeconomic status. So this is another gap that we certainly need to address, providing broader access to organized sports participation for children and youth. The committee also felt it was important to understand the physical fitness of our kids. This is one of the indicators of physical activity. We find that between 40 and 50% of kids are meeting recommended levels of physical fitness, both cardiorespiratory fitness and muscular fitness. So here we had a grade of about a C-, a slight improvement, largely due to more data on muscular fitness. So, kids spend a lot of time in school, so school is one environment which is an important setting for physical activity. In the previous editions of the report card, we put a heavy emphasis on physical education per se. However, there's a real movement towards these comprehensive school physical activity programs, which are generally written programs, written policies in schools that allow for physical education, recess, active transportation opportunities. It's more comprehensive in nature, activity breaks and these sorts of things. So only 1/3 of high school students actually participate in 5 days of physical education, which is a low number. But look at that lower number. Only 3% of secondary schools across the states actually have comprehensive school physical activity programs in place. So we believe that this will stimulate, hopefully, the schools, school districts to develop more comprehensive school programs for physical activity. We only have 3%, so we could only go up from there. The community and built environment grade, this was also the highest grade on the report card, tied with organized sports. We find that in general, we have good opportunities, at least the infrastructure available, for kids to be active. Most kids live in neighborhoods which have sidewalks or walking trails. Most kids have access to parks. So this was another highlight of the report card, that we're building the infrastructure. Local communities are doing a great job at this. However, it's the programming and it's the actual getting kids moving which needs to be addressed within these environments. So this just provides a summary of the report card grades and the indicators. As I mentioned, active play and family and peers, we could not provide a grade. However, we feel they're very important to keep on the report card, and hopefully we'll develop surveillance efforts around that. For example, we know that active play and outdoor time is important for healthy child development. However, we just really don't have the surveillance system to track active play. Family and peers, these are very important sources of influence in children's lives for physical activity. However, it's very difficult to measure that in a national survey. So these are areas where we need to move, hopefully develop some further surveillance. So just in conclusion, you know, the poor overall grade, I think, provides us continued poor outlook for the health of our children, at least related to physical activity. This comprehensive look at our children's lives and lifestyles really is an important resource to provide benchmarks and recommendations to move forward. And we need to realize, though, that even with vigorous interventions at the local, community, and the population level, it'll take some time to move these indicators. As we know, in population science, it takes time to have these big population shifts in anything like obesity or physical inactivity or dietary intake. It's going to take some time, and it's going to take some work. So in closing, I'd just like to reemphasize the report card is really an advocacy tool for educating the public and policymakers on these issues. And we hope that we can all become aware of the steps we need to take as individuals, as parents, as policymakers, and as teachers to create active environments for our kids moving forward. So with that, we're going to hear from some speakers who can respond to that challenge. So thank you very much.
Thank you, Peter. Peter will be back up here in just a few minutes to respond to questions that you might have. Well, clearly the report indicates that we've got work to do. And in order to be effective as we move forward in increasing the activity levels of our kids, we're going to have to take advantage of every resource that we can access, and we have some. And so I think the good news is a great deal of thought and effort has gone into conceptualizing, studying, pilot testing, and to some extent implementing important initiatives that can help us solve this important problem. One of the resources that we have, it's not the only one, but I hope it's an important one, is the National Physical Activity Plan. The National Physical Activity Plan, which is about 10 years old now, is designed to pursue a vision, and it is that one day all Americans will be physically active, and they will live, work, and play in environments that encourage and support regular physical activity. So the mindset is we can target individuals and groups of people, but we're going to have to change the nature of our communities if we want to influence the behavior of the residents of those communities. The mission of the organization is to maintain and expand the impact of the National Physical Activity Plan, which is a comprehensive strategic plan for increasing physical activity in all segments of the U.S. population, including kids. The National Physical Activity Plan Alliance is a coalition of national organizations, about 25 of them, that came together over the last decade, most of them committing nearly 10 years ago to this effort. And in the intervening years, the organization has developed an initial National Physical Activity Plan, which was released in 2010, and then a thoroughly updated plan that was released in 2016. The current plan, released in 2016, includes over 200 strategies and tactics that are organized around 9 societal sectors. And clearly the conceptual framework here is one that suggests that we're going to have to triangulate on this issue. There's not going to be any magic bullet. There's not going to be a single solution to this complex problem. As I say frequently, physical activity in anybody, kids included, is a complex behavior. It's done in a lot of different ways, in a lot of different places, for a lot of different reasons. And so I think we should not, assume that we're going to find just a single solution to this problem. Now, where do kids fit into the National Physical Activity Plan? Well, I think physical activity in our young people is addressed by the strategies and tactics in all 9 sectors. Peter mentioned, how important the school setting is, and clearly it is. That is a central one for kids. They spend a lot of time in school, but they spend a lot of time elsewhere as well. And I think if you take the time, as I hope you will, to peruse the National Physical Activity Plan and the initiatives that are recommended in it, you'll see that in all 9 sectors there are important initiatives that can and should be acted upon and would have the effect of increasing physical activity in our kids if we did effectively implement them. In addition to the National Physical Activity Plan, there are other very important resources available to us as we make decisions about how to invest resources and move forward with this issue. They include the Physical Activity Guidelines Mid-Course Report, which was released a few years ago, and it was focused on identifying effective interventions to promote higher levels of physical activity in our kids. The recently released Physical Activity Guidelines Advisory Committee report includes for the first time a very extensive chapter on promotion of physical activity, and many of the recommendations included in that chapter shown to be efficacious are focused, have been tested in young people. We have Guide to Community Preventive Practices that also includes a number of recommended approaches to promoting physical activity that clearly would apply to kids. So we don't lack for a sense of what we should be doing and could be doing, and that would be effective if we did it. The issue is, are we going to mobilize? Are we going to identify resources? Are we going to reallocate existing resources in ways that enable us to do a better job of implementing what we know are very likely to be effective approaches to promoting physical activity? And I'm delighted that we have several folks that are going to speak to us next here who know a lot about how to do that. And I'm very, very pleased that we have with us this morning Boris Lushniak, who will be up here next. Dr. Lushniak has had a very long and distinguished career in public health that included service as Deputy Surgeon General and Acting Surgeon General of the United States. He currently serves as Dean of the School of Public Health at the University of Maryland, and I'm thrilled that he's with us here today. Boris, please come forward.
Great. Thank you so much for that kind introduction. So I'm here now as a public health person. A career in public health, serving at the federal level, as you heard, the accolades of being Deputy U.S. Surgeon General for 5 years, Acting U.S. Surgeon General for a year and a half. I used to wear a uniform that signified the presence of the Office of the U.S. Surgeon General, medals that made me look like Leonid Brezhnev on May Day. But now I'm in a suit and in a different realm, right, which is the academic realm, dean and professor. And as dean and professor, as an academic, I have to say that this GPA that was just presented to us, this grading, is not very good, right? It's not very encouraging. And yet, both as a public health person and as an academic, I have optimism. I never give up on the student, right? We have a student who comes in who's struggling, and we say, listen, here's a pathway. Here's what we can do. Maybe we got to change things around a little bit. But at the end of the day, we're looking to make sure that things turn out better. Same with this grading scheme. Is there hope? You know, in public health, we say that unless you're an optimist, you would have burnt yourself out years ago, because the public health issues that confront our nation sometimes are overwhelming. Health, the concept of health. I have to remind you, and I love when I talk to my students about this, to remind you, if we talk about health, we talk about the issue that physical activity plays a role on our health, let's look at the actual definition of health. And I am a believer in the World Health Organization definition. I want people to close your eyes and listen to this. Just listen to this, because this is important. Health is the complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Open your eyes. The reason I want you to close your eyes, I wanted you to concentrate on these words, complete. And the three parameters about health is physical, mental, and social well-being. And in essence, when we talk about physical activity and its importance in children and youth, and ultimately its carryover into the adult lives, physical activity plays a role in all those three features. Those who are able, please stand up right now and stretch. We've been sitting here long enough, and if we're talking about physical activity, let us not spend an hour sitting on our butts. I'm sorry for the press out there. But in essence, move a little bit. Feel free, right? Stretch. After you do that, I want you to turn to people around you and introduce yourself. Handshake, hug if it's appropriate, fist pump.
I intercepted
Boris.
that.
Hi, my name's Boris.
Hi, Carly.
And now, because we have time limitations, I want you to still stand and close your eyes momentarily. Think about the beautiful day you had this morning. Those of you who commuted in, you probably walked a little bit. You actually got some exercise in. Think about how blessed we are to be in this beautiful setting at the nation's capital. Think about both the optimism that comes from a report of what could be, and yes, the reality of some element of the challenges ahead of us. But all of us come, perhaps by this session alone, rededicated to the rest of the day of what we do personally in our own physical activity lives, of how we influence those around us, how we influence our communities. Please be seated. And notice in that simple exercise, in the few minutes, we in fact did all three ramifications of the definition of health. We did physical things, we did mental things, we did social things. Why is this important? Well, those patterns that we're seeing in youth carry over to adults, right? That's a given. And the reality at this point in time, the bigger public health issue, and let me now define to you what public health is about, it's about simply the three Ps. It's about preventing disease and injury. It's about promoting health and wellness with the goal of prolonging a high quality of life. And exercise and physical activity plays a key role in all those three features. And the reason this is important is right now we are failing as a nation when it comes to health, complete physical, mental, and social well-being, as well as the patterns that exist to setting up success in that health. We're not achievers anymore. We talk about healthcare expenditure in this country. It's not really healthcare expenditure, let's be honest. Famous people in the past have called it what it truly is. We spend a lot of money on sick care. That's what it is. It's not health care, it's sick care. And what we know is $3.2 trillion a year. $3.2 trillion is spent on this sick care system in this country. And also what we know is, depending on the studies that you believe in or not, maybe 60 to 80% of those dollars are spent on preventable things. Things that are associated with our choices. Do we smoke or not smoke? Do we exercise or not exercise? Do we eat well or not eat well? Those are just the three biggies that we oftentimes talk about, but exercise plays a key component in that. So the issue of physical activity in our youth is now the harbinger of that health or lack thereof in our adult population, and that's killing us. The reality is we have an epidemic of obesity and overweight kids, youth, children. And that becomes an epidemic of overweight and obese adults, which now goes down that terrible pathway of saying, well, now we have the diabetes issue. Now we have the hypertension issue. Now we have the cardiovascular issue. Now we have the arthritis issue. Now we have the stroke issue. And yet to reel ourselves in, to be able to pull back into that mode of being prevention-oriented, this is part of the beginning. Right? The concept from years ago of exercise as medicine has a great line in it that talks about the concept that if we had a pill, if we had a pharmaceutical agent, right? We're into the world of docs writing prescriptions. I'm a doc, I write prescriptions. But if we had a pill that included all the benefits of physical activity, all the benefits of movement, all the benefits of exercises, first of all, everybody would be writing for that pill. It probably would be considered malpractice if you were not writing for that pill. Insurance companies would demand that patients be on that pill. And our culture would say, this is what we do. But we don't have a pill, and we're never going to have a pill. Because what we have to base ourselves on is that those benefits are there. They are there. They are in front of us. And what it includes now is get up and move. Right? The pill is there, but it takes a little bit of work. It takes, once again, a cultural shift. This used to be us. Right? We talk about internationally how, the countries that don't have the infrastructures, in fact, are doing much better in terms of physical activity. That's because the kids to get to school have to walk. Right? We've advanced as a society. Oh, we have cars, we have roads, we have buses, we have all these things. That's great. But in essence, we've taken a step backwards in terms of what our body is supposed to be doing, which is moving. So I propose to you pathways to a cultural shift. How does it begin? Well, it begins with, as we talked about it, making sure that this is innate within our family units. And family units are widely defined now. They are different than they used to be in the 50s and 60s. Mrs. Cleaver is around, but may not be the majority. And at the end of all this, what we have to do is the influencers of us as adults. What we do as adults plays a role in what children and youth do. It really does. So first and foremost, rededicate ourselves, everyone in this room, everyone watching on these cameras, to basically say is, what have I done today as an example for those around me? It includes the schools as a major force and initiator of this, right? I mean, it's a travesty when we say, well, recess, oh, isn't it great that we have recess in schools? But recess on its own, without having that motion, without having part of those 60 minutes achieved in terms of someone saying, hey, let's run, let's walk, let's move. There's got to be a cultural shift because we gave up on this idea of physical education in our school systems. We thought of it as, oh, it's not that important. There's too many, other things that are much more important. No, this is the future of the health of our nation. We talk about the built environment, right? We have work going on at the University of Maryland on the idea of what the built environment plays a role in this, right? Are we building neighborhoods? Do we have inner city neighborhoods that we know already are problematic in terms of safety? Are there safe places for kids to play? Are there safe sidewalks for them to walk on? This is a societal matter. Yes, it gets deep, but the idea that the infrastructure needs to be there so that people can get out. The concept of a healthy nation. When I was in uniform, I used to say that part of our achievement as a nation is to turn physical activity and to turn the idea of health into being a patriotic venture, right? We like to wave a flag on July 4th on special holidays. Well, we should exercise with that same level of enthusiasm, that ultimately this is good for the individual, right? If I exercise today, it's good for me. If I get my kids to do it, and yes, I told the kids this morning, both of them in college, that, oh, by the way, I'm at this briefing on Capitol Hill today, and by the way, I'm asking you that you make sure you get your exercise in today. Because don't turn me into a liar, because I'm going to tell everybody that the Lushniak family is into this together. My wife is at home. She's already done her stick. But the reality is that's part of the influence that we have out there. So, how does this all end? Right? We have choices to make. We have choices of a cultural shift where we start walking again. A few years ago, we began the report. Another Surgeon General took it on and completed it. But it's a simple report, and it talks about not marathon running. It doesn't talk about climbing mountains. It doesn't talk about triathlons. What it says is creating an emphasis on walking and walkable communities. Right? We don't need an expensive pair of running shoes. We don't need membership in a health club. You know, we've been inundated with a society that says, oh, if you're not super achieving, then it's not, no! As a nation, let's begin walking again. Let's begin bicycling again. This past Saturday, I'm an exerciser. And I completed a 6-day journey of bicycling through the rain last week from Pittsburgh to DC. The Gap Trail, the C&O Trail. We got diverted with floods. This was difficult. Ultimately, we didn't finish on the C&O. We finished on the W and OD Trail coming in from Purcellville on nice dry pavement on a beautiful Saturday. And my level of enthusiasm after, as a Dean of Public Health, as a former acting U.S. Surgeon General, that week was spent looking at public health issues through rural Pennsylvania, looking at the world. I went out, to quote Paul Simon, to see America a little bit. And I'll tell you, the enthusiasm of coming in on a Saturday on that trail was bursting out of me. Because the trail on a beautiful Saturday was filled with families, with young kids on their bicycles enjoying time. What a great way to enter our nation's capital with that level of enthusiasm. And yet we know there are inequities. Simple maps. Right, I'll show you the metro system of DC, and stop by stop, I'll show you the average lifespan of that community. So it's not good enough to say that in suburban Virginia there was tons of people, and as I noted to others sitting next to me, as I came closer and closer to DC, the number of kids on bikes decreased. So let's not pretend that it's all peachy keen. But the reason I'm pointing this out is there is hope. And we are part of the answer. The alliance that has done such incredible work is part of the answer. Right? This conglomerate of different organizations who are out there pushing this agenda. We need to make sure that the word gets out. That we have to start moving again. For the good of our nation. For the good of our communities. For the good of our families. And for our own well-being. Thank you so much for your attention this morning.
Boris, thank you so much for being here and for those inspirational words. So I mentioned earlier that the National Physical Activity Plan Alliance is a coalition, and the way we're able to undertake projects like this is to go to our affiliated organizations and ask them to support activities like this one. And I'm delighted that 3 of them agreed to provide very important support that enabled us to undertake this project. And we're going to hear now from representatives of each of those 3 organizations. I'm going to introduce all 3 of them right now, and they're going to come up one after the other. First will be Carly Wright, who is Senior Manager of Advocacy for Shape America. Second will be Tom Richards, Director of Corporate Engagement for ACE, the American Council on Exercise. And third will be Jim Whitehead, who's the CEO of the American College of Sports Medicine. So, Carly?
Thanks, Russ. I am Carly Wright, Director of Public Policy at Shape America. So we are the organization that represents our nation's health educators and physical educators across the country. And as Shape America, we envision a nation where all children are prepared to lead healthy, physically active lives through effective health and physical education programs. Emphasis here on all children, right? A child's gender identity, race, location, ability, socioeconomic status, nor any characteristic or circumstance should impact their opportunities to be physically active, and to do so with competence and confidence. Yet we know there are disparities that exist. This is why school-based physical education and activity policies and programs are critical to improving this overall score of a D-, right? Schools and specifically physical education programs are where we have the opportunity to reach all children, regardless of their athletic skill or ability. A comprehensive school physical activity program, or a CSPAP, is a multi-component approach by which schools use all opportunities for students to be physically active and to meet that nationally recommended 60 minutes of physical activity each day. Also, to develop the knowledge, skills, and confidence to be physically active for a lifetime. A CSPAP reflects strong coordination and synergy across all 5 of the components: physical education as the foundation, physical activity before, during, after school, staff involvement, and family and community engagement. Physical education is an academic subject and serves as the foundation of a CSPAP. Physical education provides students with a planned, sequential, pre-K through 12 standards-based program of curriculum and instruction designed to develop students' motor skills, knowledge, and behaviors for active, healthy living, physical fitness, sportsmanship, self-efficacy, and emotional intelligence. So we do try to hit all of those: physical, mental, and social there. Before and after school physical activity programs might include a walking or biking to school program, physical activity clubs, intramural programs, informal recreation, or play on school grounds, physical activity and school-based childcare programs, and interscholastic sports. Physical activity during school includes those opportunities to be active throughout the school day that are in addition to required physical education instruction. These ways mainly include recess, physical activity integrated into classroom lessons, and physical activity breaks in and outside of the classroom. And it's important that these opportunities be offered to all grade levels, pre-K through 12. Family and community engagement in school-based physical activity programs provide numerous benefits. Parents, guardians, or other family members can support a CSPAP by participating in evening or weekend special events, or serving as a physical education or physical activity volunteer. Community involvement allows maximum use of school and community resources and creates that connection between school and community-based physical activity opportunities. Staff involvement in a CSPAP and support for school employee wellness and leadership training contribute to an overall culture of physical activity at a school. School employee wellness programs improve staff health, increase physical activity levels, and are cost-effective. And probably most importantly, for students, school staff that are committed to good health practices are positive role models for their students. But most importantly, and probably most dear to my heart, it's critical that physical education and comprehensive school physical activity programs are written into policy at the state and local level to ensure that sustainability and implementation. Without strong policy in place, a teacher that may have championed a physical activity program could leave the school and the program may leave with them. We must ensure accountability for school administrators to provide children with maximum opportunities to be active and to develop healthy habits that can last a lifetime. There is great work that's happening in schools all across the country. Teachers in Wisconsin may introduce their students to activities like snowshoeing and orienteering. In Miami, they teach students sailing. In Louisiana, bowling and inline skating. And here in our nation's capital, bike and water safety skills. There are definitely more and more bright spots and success stories to point to than there were in previous years, but it is still clear that we have a long way to go before we can truly say we've bridged the research to practice gap. So we hope all of you here today will join us in these efforts to empower the children of today to become a new generation of physical activity lovers and champions. Thank you.
Thanks, Carly. Good to see you. Well, my goodness, everybody, I wish I had Dr. Lushniak here when I brought some of these report cards home when I was a kid. I was fired up. Mom, Dad, this is an opportunity. This is a way forward here. So thank you for that. My name is Tom Richards. I'm the Director of Community Engagement for the American Council on Exercise, ACE. We're a 501c3 nonprofit whose mission is to get people moving. And we're guided by that mission because we believe movement is at the core of what it means to feel healthy, to feel alive, and to engage in the human experience. And that's why we are eager to support the development of the report card, and why we're so grateful for the great work of the plan and for the Research Advisory Committee that really did a tremendous job on this. So obviously, this is not a great report card. Highest grades a C, lots of D minuses, no gold stars, definitely not going on the national refrigerator anytime soon. But there are some real successes and hopes that we can point to, and we can build on that with confidence. And we should expect, Dr. Pate mentioned the 9 sectors of the plan. We should expect every sector of the plan to contribute, not just the ones with some kind of obvious connection to kids. And I'm thinking particularly of the business and industry sector. We think of business and industry as kind of employee wellness, employee health. That's for employees, that's for parents. But we know that healthy employees can lead to healthy kids. And that employees who move more, who seek activity and embrace a healthy lifestyle, are more likely to be positive role models for their kids in the areas of physical activity. And raise kids who understand the importance of physical activity, not just as kids, but throughout their lifespans. And there are already some fantastic businesses that are showing the way of how you can do this. For example, there are over 500 organizations already that have signed something called the CEO Pledge for Physical Activity. And that's an initiative that came right out of the plan. And as it would suggest, it's actually a pledge that the CEO signs to provide a supportive work environment for physical activity. And at the preamble of the pledge, it states that up front that this is for the betterment of my company, our employees, their families, and their community, right? Their families and their community. Because active employees lead to active families and active communities, and happy active families lead to happy, engaged, and productive employees. So it's really this wonderful circle. And there's no doubt about the role that business and industry can play. I think I stepped on something. There's no doubt that for the role that business and industry can play, and there's no doubt about their incentives to play that role. I'd like to talk in particular about one industry, which is near and dear to my heart, and that's the fitness industry. I believe that they have the capability, the expertise, and most importantly, the compassion to do what's necessary to bring up these grades. I'm thinking of group fitness instructors, personal trainers, health coaches. And yes, they're already working with youth, and they're making positive changes and sustainable habits, but they could be doing so much more if they could make these community connections. So at ACE, we're taking this moment, this release of a disappointing yet hopeful report card, to consider how we can help affect real change. Over the last couple of years, for example, we've had an initiative called the Community Investment and Engagement Initiative. It partners with local groups that are already providing some physical activity experiences in vulnerable communities, and we're helping those groups to make their work more impactful and engage more people. And we're hopeful that this type of collaborative grassroots effort will help bring these grades up, but there's more that we can do. We're also calling upon our family of exercise professionals and health coaches to consider what they can do in their own communities to provide leadership, experience, and inspiration to the sedentary children that they see all around them in their neighborhoods, their cities, and their towns. And we're calling upon local leaders and community-based organizations to reach out to exercise professionals, reach out to the health coaches, make these critical community connections to get people moving. In every community, for every child, regardless of whether the child's family can pay for services or not. At ACE, we believe every child in every community deserves the opportunity to move and be active. And very importantly, that child deserves ready access to safe physical activity options, regardless of income or ability. We know that the family of 80,000 plus ACE professionals shares our belief. I know everyone in this room shares our belief. So we are committed as an organization to do what we can to improve these grades, to find opportunities for our professionals to help the youth of their communities, to highlight the wonderful success stories that can happen when these community connections are made between leaders and exercise professionals. And we look very forward to working with the Alliance more and working with anyone who shares our desire to get kids moving. So, thank you. Russ.
Well, thank you all very much for being here and for your commitment. I'm Jim Whitehead. I'm the CEO of the American College of Sports Medicine. And we have recognized the urgency of this matter for a very long time. FACSM is the largest sports medicine exercise science organization in the world. And we've been involved in all of these efforts, including the National Physical Activity Plan. I'm the chair of the sports sector, co-founder of the National Coalition for Promoting Physical Activity, and on it goes. And so many of you have been part of this, and we applaud and appreciate your leadership and your commitment. This is something that is very important. It is gaining worldwide attention in regard to physical activity and physical inactivity and the challenges that has not only for today, but for the future. Last week, the United Nations held a high-level special meeting on non-communicable diseases, and physical inactivity was cited very significantly being a major problem, something that needs action. WHO, the World Health Organization, has just released a call to action on physical inactivity worldwide, looking at the massive toll that takes, not only today, but what's the arc in regard to what will happen in the future. It's non-sustainable. This is like if a meteor were heading toward this planet, we would begin to do something about it. Well, there is a meteor of sorts headed for this planet that we need to do something about together. There are many promising things here. This report card is really more of, national numbers are hard to move quickly. We all know that. There are many instances of bright success, major commitments at the local level. In some ways, our future is moving to local. And you can see that in the literature, you can see that in social change science. It is, because that is where things can be influenced. So that's one thing, that whatever we would do, your organization would do, and so forth, if you are working at the community level, you are help driving the future in national trends, and we would encourage you to continue to be part of that. Another aspect is, collective impact science is really beginning to become on its own, where when you have organizations and people working together, that it really has an amplifying effect where the sum is far more than the parts. And it is important that we work together, and we do that so well, as reflected here with the National Physical Activity Plan and in other arenas that are out there that you can all be a part of. And I would say just one call to action. I would hope that you would come out of this meeting and identify something that we can do additionally together, or your respective organization, or you as an individual, you as a change agent, as an individual within your own home, within your community, with the organizations that you belong to. I want to leave some time for questions, so I'm just going to wrap up here with a couple of thoughts to share. Nelson Mandela said that it always seems impossible until it's done, and we have to grasp on to that belief. That report card is not good, but if we have progressive effort underway together, collectively and individually, we will ultimately change those national grades. but we also will be doing things in the meantime in our communities, in our organizations, in our families, and everywhere that we are. John Kennedy said that our most basic common link is that we all inhabit this planet. We all breathe the same air, and we all cherish the future for our children, for ourselves, for those unborn. And we do cherish that future, and we want it to be even better. And I assure you that what we're doing here, our commitment to this cause of improving not only health, but economic development, of social responsibility, of environment, it has so many co-benefits that we actually are changing not only health, even though how fundamentally important that is, but the future itself. I applaud you and appreciate for your leadership in this collective effort that we have underway. Thank you very much.
Thank you, Carly, Tom, and Jim. I'm going to ask Peter and Boris and our other speakers to come forward, and I think we have a few minutes for questions and discussion, so please come on up if you would. And if you care to direct your question to one of the speakers, please do. And we've got a floor mic there, so we're being recorded, so it would be helpful if you use the floor mic if you have a question.
I think Peter probably can answer this best. I know other countries have put out similar report cards. Can you talk a little bit about kind of how we're doing relative to other countries, how their movements is going?
Sure. We are part of the Active Healthy Kids Global Alliance, which is an international organization releasing these report cards. It started with about 15 countries in 2014. In 2016, we had about 30. And now in 2018, we have 49 countries who are all releasing similar report cards using the same grading rubric. And so we will be releasing this report card internationally at the end of November with these 49 countries. And I could tell you that no single country is leading or lagging in any of the specific indicators. There are all strengths in different areas. We are leading in terms of infrastructure, built environment, access to parks, and these sorts of things. And that's fairly typical for the industrialized Western countries. In developing countries, they're really leading in physical activity levels. And so you see this strong negative correlation between economic development and physical activity. So although we tend to focus on building the infrastructure, the other countries that don't have any infrastructure are actually doing better. So again, we have to think about going backwards in time where we're not as developed, and we need to make the physical activity the easy choice rather than competing with the cars and the buses and everything else. So this is why we're learning from one another in all these different countries.
Hi, Carrie Young. I'm writing for Medscape. So looking at this report, what advice should, say, a family physician take away from this? What can physicians do to encourage? Can they write prescriptions for exercise? There was that National Parks program a few years ago.
Yeah, I think as a physician, I think part of it is entering into that clinical world to realize that it's not just about pills. And I'm being very bold here in saying that. In medical schools training, there's a lot of training in terms of the sick care concept, and you want to diagnose appropriately. You want to make sure that, and you want to solve the person's problem. What I'm looking at is a more of the holistic approach from all aspects of the healthcare professions, not just physicians. But this is a team effort. This will take a village, and part of it is let's look at the concept of exercise. Let's look at the concept of getting out into nature, right? Let's look at the idea of movement as part of the formula. And I think coming from the world of the healthcare professionals, it adds to the message. As already stated, what we want to do is to make this the easy choice. I think that the approach in public health needs to be ultimately, I can't tell you what to do, right? Even with a fancy uniform at one point, you can't just say, don't smoke, eat better, exercise more, right? Americans aren't set up to take orders. But what we can do in public health, and this is everyone in that whole family of healthcare professionals, public health professionals, organizations, is to get out all the facts. And if we get out the facts and make it understandable, i.e. health communication, to make sure that the person is understanding of all the concept from a health literacy component, so health communication, health literacy, and that ultimately we give out all the information, correct information, and basically say it's your decision. It's a setup for that person to make the right decision.
Hi, I'm Ebony Andrews from the President's Council on Fitness, Sports, and Nutrition. And I have a question regarding the significant drop in physical activity levels, especially when I see the 12 to 15-year-old group and the 16 and 19-year-old group at 7.5 and 5.1%. And I'm curious if there's any data connecting this to youth sports, because this is our current priority. If there's any data that shows what percentage of youth that play sports in those age groups are meeting the physical activity guidelines?
I'm going to comment quickly because I care about that issue, and then I'm going to ask Jim to comment. Actually, my research group is looking at data right now that shows that in longitudinal data, as kids progress from elementary to middle school to high school, those who indicate that they are engaged systematically in organized sport remain more active than kids who indicate that they're not. We know in kids overall, there's an age-related decline in activity. We see that decline is not nearly as steep in kids that are engaged in organized sport and other related physical activity programs. Jim?
Thanks, Russ, and thanks for the question. We applaud the President's Council emphasis on youth sports because we think it's a fundamentally important platform. Without a doubt, as Russ indicated, sports is a wonderful platform for not only youth physical activity, but sustained physical activity across the life course. But there are opportunities for improvement in youth sports that need to be addressed. There are a number of initiatives out there, even from Aspen Institute and many others, that are looking at how collectively do we work together to make sports even more enjoyable in terms of trying to identify what are the things that would make it not an enjoyable experience. And there are some, but the good news is there are many things that can be done about that to make it more inclusive. Everything that we should do should be approached in a very inclusive equity manner. And we need to look at that. And furthermore, to make sports even not only enjoyable, but even safer. Because we start looking at what are the three elements that really do detract from sustained and enjoyable and participation in sports, not only as youth, but across the lifespan. And we're going in a very intentional way. How do we address those now and really use sports as this wonderful platform for physical activity?
Thanks. Karen Whitaker, League of American Bicyclists. I just want to say I appreciate that for your active transportation measurement, you went from just measuring the trips to school to all trips. We find that that's true for people of all ages, that they're more likely to do personal trips by bike or by walking than necessarily their commute, whether that be to work or school. So I'm wondering if you could talk a little bit about the data source, where you got that data, because we have a hard time getting similar data for adults.
Actually, there's a module in the national, it's the U.S. National Health and Nutrition Examination Survey, 2015-2016 cycle. So we were able to obtain the raw data by downloading from the National Center for Health Statistics and able to analyze that data. So it's available on that website.
Bill Sells, Sports and Fitness Industry. Oh, I'm sorry. Bill Sells, Sports and Fitness Industry Association. Thank you for doing this. I saw that the organized sports got a C, which I guess makes me happy, but not really. As I was looking at the graph, it showed that there was a real issue with the lower the income, the lower the participation levels. I'm wondering, did you have any data on the impact of pay-to-play policies in high school sports on participation?
I don't think we did, but I'll editorialize briefly to say that that is a huge concern to me, and I think probably most of us. We've systematically privatized some of the physical activity opportunities that kids have traditionally had. that clearly discriminates against families and children in families that do not have the resources that can be applied to that. I personally think, as a society, we need to address that. That's just, in my opinion, wrong. that kids should not have appropriate access to high quality physical activity programs, because of their family's disadvantaged situation. So
Tap into sports betting revenues.
Good morning. Hadia Green Guerrero, the American Physical Therapy Association. When looking at the grades of the organized sports and the school report card grades, I am wondering what information was gathered as far as organized sports as it relates to school and how that was delineated between the two grades.
Typically, the questions on the surveys didn't differentiate between, school-based organized youth sports or community-based. It was asking the children, how many sports teams they played on. So it was more general than that. And I'm not sure we had data on school versus out of school. We do have data from the American High School Athletics Association, which show that the most popular school-based organized sports in both boys and girls, and we have a table in there with that. And we also have overall participation rates in high school athletics, and there's a graph in there about that, but we couldn't really differentiate the effects.
yeah, I'll just add that, as everybody in this room knows, one of the core public health functions is surveillance. And I think in the youth sport participation arena, we have quite good information on school-based sports program participation, and we have a huge void in our knowledge of kids' participation in community-based programs. And some of you know there are groups thinking about what we need to do to create a more robust physical activity surveillance system in this country, and addressing that gap is, I think, being treated as a priority in some of those efforts. Maybe one more question, I think.
Hi, my name is Michael Vera. I'm a graduate student at the George Washington Milken School for Public Health. So I think it's really cool that this emphasis is also on public health. But I have a question about the epidemiological trends. A lot of the diseases that were talked about were diseases that affect primarily adults and elderly. But I'm wondering if this investigation did any, uncovered any diseases or health outcomes that affect children in its report.
We didn't go so far to address the health conditions associated with physical inactivity, but as Dr. Pate mentioned, that the 2018 U.S. Physical Activity Guidelines Advisory Report really delved into that, looking at bone health in children, cardiometabolic health markers. We looked at the prevalence of weight gain and prevention of weight gain, as well as academic performance and cognition, which are all improved by physical activity in children. So we try to focus on that. But you're absolutely right. A lot of the diseases worldwide that we attribute to physical inactivity, such as coronary heart disease and cancer and stroke, these things don't appear until adulthood. But they're long-term conditions with a genesis in childhood. We understand that the primordial prevention of cardiovascular disease really needs to start in childhood. And so that's how we anchor a lot of our efforts in the kids.
And let me just add one thing, which I think is a great observation from a graduate student, of course, and that being that this really is a public health issue. And I think one of the pathways that we've gotten really great progress on is the reality that we're now a combined force. Where in the past, I think there had been sort of, the industry was there, the government was here, outside organizations were here. I go back to that definition of public health that I gave earlier. The part that I didn't give is that the public health is both an art and a science, and it involves that partnership. It involves a partnership of government, of academia, of private and public organizations, right, for ultimately the good of that society. And I think we really need to sort of continue this approach, which ultimately is we may be doing it from a whole lot of different angles, but ultimately this is about public health, and public health doesn't just belong to the feds or to academia or to one entity. To progress in this area, it's going to take that concerted effort.
So I want to conclude on a positive note here. You saw that the grades weren't great. But you need to look at how the grades were assigned. And while it's true that a lot of American kids are not meeting physical activity guidelines, millions of them are. Look at every metric in that report card. The scores weren't zero. Okay, they're lower than we wish they were. But as Carly emphasized, many schools across the country are doing a wonderful job. We need more of them to do a wonderful job. The same is true for the various community metrics. It's not that these ideas about how we can promote physical activity in kids, have come out of the blue. They've come from practice. All of them are recommended because they're known to work not only from a research standpoint, but most of them from a practice standpoint. We just have to tip the scales here. We've just got to move the dial so that more and more communities, more and more schools, more and more kids are meeting the guidelines than are now. But we shouldn't lose track of the fact that this can happen because many communities across the country and millions of children across this country are meeting the guidelines that are recommended. So I want to conclude by thanking my colleagues here very much for their participation, and most of all, thank you all very much for being here. We've had a great group and a great session. Thank you for your interest.
Thank you.